Your exploration of spironolactone's potential relevance to joint effusion is well-rounded, covering both its established pharmacological actions and its speculative applications in this context. Here's a more detailed analysis. Mechanism of action. Spironolactone is a competitive antagonist of aldosterone, a hormone that promotes sodium and water retention in the kidneys. By blocking aldosterone receptors, spironolactone increases sodium and water excretion while conserving potassium. This diuretic effect reduces fluid volume in the body, which can lower blood pressure and decrease edema. Potential role in joint effusion. 1. Reduction of systemic edema. Joint effusion can sometimes be part of a broader pattern of fluid retention in the body, as seen in conditions like heart failure and renal impairment. By reducing overall fluid volume, spironolactone might help alleviate joint effusion in patients where systemic fluid overload is a contributing factor. 2. Anti-inflammatory effects. Research indicates that aldosterone can contribute to inflammation. Aldosterone antagonists like spironolactone might exert anti-inflammatory effects by inhibiting pathways that lead to tissue inflammation. This can be particularly relevant in inflammatory arthritic conditions such as rheumatoid arthritis, where inflammation drives joint effusion. Adjunct therapy. Spironolactone might be used as part of a broader therapeutic strategy in patients who have both fluid overload conditions, like heart failure, and inflammatory joint diseases. By managing fluid overload, spironolactone could indirectly reduce the severity of joint effusion. Clinical evidence and use. While spironolactone is primarily indicated for conditions like hypertension, heart failure, and certain forms of edema, there is limited direct clinical evidence supporting its use specifically for joint effusion. However, the potential anti-inflammatory and fluid management benefits could make it a useful adjunct therapy in certain cases. Considerations. Individualized treatment. Each patient's situation is unique. The use of spironolactone should be tailored to the individual, taking into account the underlying cause of joint effusion, the presence of comorbid conditions, and the overall treatment strategy. Monitoring. Due to its effects on potassium levels, it is crucial to monitor electrolytes and kidney function regularly to avoid complications such as hyperkalemia. Specific study insight. The study by Ahmed El-Saman et al. In Egypt suggests that spironolactone may be beneficial for managing joint effusion, likely due to its anti-inflammatory and diuretic effects. However, further research and clinical trials are necessary to establish its efficacy and safety, specifically for this indication. Conclusion. While spironolactone is not a primary treatment for joint effusion, its diuretic and potential anti-inflammatory effects might offer some benefit in reducing fluid accumulation and managing underlying inflammatory conditions. Its use should be carefully considered and monitored within a comprehensive treatment plan tailored to the patient's needs. By understanding the multifaceted role of spironolactone, healthcare providers can make informed decisions about its use in managing conditions that include or contribute to joint effusion.